Looks like we've got some folks hopping on. Welcome everyone to our session today. We'll get kicked off here in a few minutes. So if you need to, I guess, refresh your coffee, if maybe you're in that particular time zone, or if you need to grab some water, feel free to go ahead and we'll probably get started at about 1 after. I like in the chat, Patty said, Cynthia, this is the third time today we've been in a meeting together. I sure do love our small healthcare world here in our very big and beautiful state. Jeff is joining us from North Dakota. And he was just informing me that they had 50 inches of snow in, what was your time frame?
We had 50 inches of snow plus 50 plus inches of snow just in the month of April. And that's not counting the extra precip of 2¼ inches and 2 more that's coming this weekend. So I'm looking forward to getting back to my home state of Montana as soon as possible.
I was joking and I told him, you go ahead and leave that snow with you, especially April. We're ready for winter to be over with. Oh, I see my good old friend Jackie Dittman. Hello, welcome. Yes, my hair has changed a little bit, I think, since the last time we saw one another. Yeah, it's been a long time. All right, and Gloria says, yes, please leave the snow there. All right, so with that, let's go ahead and get started. I'm sure we'll have some folks kind of trickling in, but want to welcome everyone to our session today. We're going to be talking about team-based care and prioritizing the wellness of our team. As most of you know that have worked with me before, I love a good icebreaker. So let's go ahead and do the icebreaker. Next slide. So do you prefer coffee or tea? I'll take it one little step further and see what your coffee or tea of choice is in addition. Anyone that's been to a conference with me knows I take coffee with my oxygen, and I am a Americano kind of gal. We had a lot of coffee lovers in the chat, holy cow. Jeff, you're a tea guy, aren't you?
Actually, I'm neither. Yeah, I'm a caffeine-free guy, so you don't want to be around me when I've had some caffeine in my system.
I love it. All right, Kevin Frankie chatted in, coffee, dark. I'll try not to gloat too terribly much that I was just in Costa Rica and drank a lot of very good dark coffee. So Deb says both. Oh, we've got an AeroPress fan. I do love that brewing method. I like to collect the different ways to brew coffee. So it looks like we've got an assortment, but I think coffee is our winner today. Okay. Great. We'll go to the next slide. All right. So for you, those of you that are new to kind of this little group, our presentation is brought to you by our regional partnership and specifically our regional chronic disease collaborative. So this incorporates partners from the departments of health from Hawaii, Alaska, Montana, and Wyoming, as well as Primary Care Association and the American Heart Association. So with that, we have the ability to bring together large groups of people from all of the very diverse and beautiful states that we work in. So very excited to hear all of the different successes and kind of what's going on. I think those of us in Montana, Wyoming, and Alaska probably could be dreaming of some palm trees for our Hawaii partners. So this is definitely a good old regional collaborative. All right, so some housekeeping items here. just make sure to kind of mute your line if you're not speaking. This is definitely meant to be an interactive experience though. So as you have questions, please feel free to put those in the chat or raise your hand and we'll go ahead and engage you there. Next slide. All right, for those of you that don't know me, my name is Kristen Schuster. I'm with Mountain Pacific Quality Health. With me today, I have Jeff Redekop, who is with the Quality Health Associates of North Dakota, and I'm very happy to have Lacey Alexander with the Montana Primary Care Association as my co-host. We also have some fabulous practice presenters that we're going to hear from later on in the session, so lots of great things. Next slide. Okay, what's the agenda for the day? Let's get into the meat and potatoes. So we're going to go over team-based care. We're going to look at the definition, overview, and benefits. We're also going to examine the elements of successful team-based care, especially in today's reality. Look at key concepts of emotional intelligence, psychological safety, and resilience. Strategize effective strategies to promote team recovery and regeneration. Our fantastic practice presenters to share you some ideas and experiences. And then we've got some calls to action and some next steps that we're going to explore. Next slide. So with that, I'm going to turn it over to Lacey to get into our presentation on team-based care. Take it away, Lacey.
Great, thanks, Kristen. Welcome, everybody. So let's just start with the definition. Team-based care is really a collaboration of professionals that really have shared responsibilities, shared goals for high quality and efficient care, healthcare for patients. Next slide. So let's dive into that a little bit. Team-based care really has some basic structures. So the organization team structure, which would be your workflows, right? Where, when, and how, and your team functions are really that collaboration of who does what is your roles, and the shared goal and mission of creating that culture of really, we want to, as a team, to improve our quality. That could be patient outcomes, patient satisfaction, or team satisfaction and your healthcare environment. Next slide. So this was really framework was developed by the Institute of Healthcare, and it really shows how team-based care works and what should happen after you have really good, effective, and high efficient teams. So starting with your staff. So if our staff has not the burden of, complicated patients like chronic patients, and it's not one person having to take care of those patients. So they don't have the burden. They can spread it out with other people and other team members, and they know their roles. They feel safe in those roles. They know who to talk to. If they don't know the answers, they know that they're backed up by somebody that can get those answers and really improve their outcomes. So if your teams are really, and your staff are happy, they're working together, they know when, how, and where, and who's doing what, you're really going to have better outcomes. If your patients are better outcomes, we're measuring them, that's our goal. If they're not working, we're going to go back to our team and say, these outcomes are not working, it's not one person's fault, we're going to figure this out. Then you're really going to have patients that feel better. And if they feel better, they are confident in that they know how to treat their chronic, complicated healthcare issue. They know who to talk to because your team is there and they know who to go to, and they feel safe, confident. And so then they're not going to be your high utilizers and clogging up your system. And so your cost is going to decrease. And so that's kind of how that framework works. It used to be the triple aim, and now it's the quadruple aim. Next slide. So here's all the benefits. And if you're having these benefits, right? So the patients are feeling better, you're working good, you feel more satisfied, you're going to feel safer in your environment, you're going to be working together and feeling like you can improve and you're making a difference, and people are all around going to feel better. Next slide. So really, we want to ask you all, who is in your team? So if you can just put in the chat box, who's the members of your team? And this, as you're doing that, this is really my time to be on my soapbox of really thinking about who is in your team and who does that include in your community, out of your community, in your center, out of your center, who is in your team. And my biggest soapbox, so if you could just start putting in the chat box, who is in your team? My biggest soapbox is really thinking about your paraprofessionals and your receptionists. So really thinking about your receptionist as a team member. Why would your receptionist be the most important person, right? So we talked about knowing who to go to, feeling safe, feeling satisfied, and who's the person that your patient really starts that domino effect is really your team member, which is your receptionist or your nurse navigator or the person within the community. So I see QI coordinators. Who else within that would be your QI coordinator? You're an MD, MO, NP, patient access rep, social worker, care manager, pharmacy, great. And a lot of times, right, we're really thinking about people in and out of your team and who that team is and how that expands. Really thinking about how we communicate that. Patients in and out, right, your patient needs to be your team member. Your IT department, aren't those people, we forget about those people. Yep, our billers, super important, right? If we don't get paid and they can't get paid, then we're all out of jobs. Right. Great. Anybody else? I'll give you a couple more minutes. I think really
we got some big teams on the line.
Yeah.
I was gonna say we got some big teams. This is awesome.
Even if you're a smaller team, thinking about how many hats everybody wears. So if you're wearing, going kind of back up to our staff satisfaction, if you're wearing many different hats, that's great, but it's really about communicating that team structure and that team functioning. Awesome. We have some awesome teams. Community-based organizations, yep. Okay, next slide. Thanks, everybody. So these are really the elements of team-based care, which we've talked about, right? Shared goals, shared roles. If you have a shared goal, shared role, that makes your mutual trust. If you have effective communication, that also makes you safe. That also has mutual trust between your patients and all your team members, and really measuring those processes. Because I, as a team member, might think that my outcome is different and my definition is different. So really having those shared goals, but also having those shared outcomes and tackling those as a team. And in this time, so we're talking about the pandemic, how do you do this when you feel exhausted? So when you feel exhausted, how do you have or build back that mutual trust, that effective communication? I think communication is the first thing that drops off. How do you do that? And so Jeff is really going to talk about psychological safety, emotional intelligence that really cultivates that resiliency after the pandemic. Jeff?
Thanks, Lacey. Next slide. There's been a lot of negative and positive effects on care teams as a result of what we've experienced with COVID. And we can learn from both the good and the bad. There's never been a better time to help redesign the structure of how we provide care that can lead to increased patient and care team satisfaction. Next slide, please. So one of our primary destructive factors the pandemic has caused is that it's really interrupted and impaired our ability to engage with others. Social distancing, staying at home restrictions, and fear of contracting or spreading COVID has really severely curtailed our opportunities for in-person interactions. We're not focused enough on our relationships, and it's really coming at a cost. That's why, given what we've experienced, it's especially important to reconnect with others to nurture our recovery and our regeneration. Next slide, please. So here are some key elements that are going to help you and your team recover and regenerate from what's gone on the past 2+ years. As we move through our presentation, we're going to dig into the specifics of each category and connect the concepts to be able to build an environment that fosters a high-functioning team. Psychological safety creates a space for team members to thrive and be creative without fear or judgment. Emotional intelligence helps us think before we react, expands our self-awareness, and helps us empathize with others. Resiliency gives us the capacity to recover quickly from difficulties. Next slide, please. There's one concept that's vital to developing a social strategy that leads to a complementary team culture, and that concept is psychological safety. Research shows that high-performing teams all have one thing in common: the belief that they won't be punished for making a mistake. Psychological safety provides space for the positive emotions like trust, curiosity, confidence, and inspiration that broaden the mind and help us build psychological, social, and physical resources. We become more open-minded, resilient, motivated, and persistent when we feel safe. Humor increases, as does solution finding and divergent thinking, which are the parts of the cognitive process that underlie creativity. Next slide, please. So when the team members feel comfortable asking for help, sharing suggestions informally, or challenging the status quo without fear of negative consequences, organizations are much more likely to innovate quickly, unlock the benefits of diversity, and adapt well to change. A good example of this is a practice at the practice level was shared at a 2021 learning event by a North Dakota practice in Mandan. Each morning, the care teams huddle for pre-visit planning and discuss any gaps in care that have been flagged in the EHR. Each team member has an equal voice and space to bring up concerns and make suggestions because there's no vertical hierarchy. This builds positive and engaged team culture and improves communication and proactive planning for the scheduled patients. Next slide, please. Emotional intelligence can include skills like emotional awareness, the ability to identify and name your own emotions, the ability to harness those emotions and apply them to tasks like thinking and problem solving, the ability to manage your own emotions, and also help regulate, when necessary, others to be able to do the same. So developing our own emotional intelligence helps us think before we react, expands our self-awareness, and helps us empathize with others. We can use emotional intelligence to accept criticism and responsibility, be able to move past making mistakes, saying no when we need to, and also solve problems in ways that work for everyone on the team. Next slide, please. So good emotional intelligence gives teams a foundation to work together productively by creating a shared sense of empathy that ensures the team members understand each other and the problems that they're dealing with. It allows the team to prioritize communication and collaboration. Emotional intelligence and teamwork must coexist together so that teams will have the ability to be able to resolve conflict, collaborate effectively, practice self-awareness and emotional management, understand the capabilities of the team, and also foster motivation. Next slide, please. Fear has detrimental effects on work performance, and when it's removed, people perform better. One profound point that Timothy R. Clark states is that only by analyzing the emotional intelligence inputs of the leader can you understand the psychological safety outputs at the team level. Each person's level of emotional intelligence helps to form the level of psychological safety on the team. And people with higher levels of emotional intelligence expand psychological safety, while those with lower levels deplete it. And leaders with low levels of emotional intelligence can induce fear and patterns of risk management, pain avoidance, and self-preservation, while leaders that have empathy, a sense of humor, and higher levels of emotional intelligence really open the door for rigorous debate, constructive dissent, and moderate risk-taking. Next slide, please. So there's 4 traits that help teams become psychologically safe. These traits are self-management, self-awareness, social awareness, and relationship management. Team members with self-awareness and the ability to self-manage are better equipped to deal with words, behaviors, and actions they take exception from from peers that are on their team. And individuals with higher level of social awareness and relationship management are better at recognizing discomfort from teammates and can help those who are quiet or feel somewhat averse to being able to speak up. Those two traits also help with conflict resolution and can spur action to be able to intercede when one of your fellow teammates or our fellow teammates are mistreated. And now I'm going to hand off to Kristen, who's going to talk about how psychological safety and emotional intelligence tie in with resilience. Kristen.
Great, thanks, Jeff. Before I get into that, we had a question in the chat from Ashley, and Ashley asked, how can we support psychological safety when environmental, external situations threaten it, i.e. the nurse who was charged due to an error recently? So one of the things with psychological safety is the focus of, controlling our actions and having a leadership that supports a safe environment that addresses errors and challenges in a productive manner. So we won't have the ability to always be able to react to, external factors or, maybe extenuating circumstances like COVID, for example, but we have built a team and an environment that feels safe and supported to be able to problem solve and work through challenges in a way that is productive and safe without being, without fear of repercussion, without getting in trouble, so to say. So it's psychological safety and emotional intelligence are two skills that we as individuals and as an organization need to set time aside in order to foster and create the habits. So when something happens, and this is kind of where resilience comes into play, when something happens, we have a foundation that we can pull from, so we have that safe environment. So we're really looking at psychological resilience kind of overall, which really is having the capacity to mentally and emotionally cope with a given crisis, and then be able to return where we were before the crisis and take lessons and the lessons we learn and apply those to future challenges that are inevitably going to come up. Resilience exists when we use behaviors and mental processes to draw on our personal strengths and the strengths of our team to protect ourselves from the potential negative effects of stressors caused by the situation at hand. Next slide. So resilience really isn't about, gliding along and going on cruise control. I think we would all love if we could just interact with a perfect world and a perfect dynamic and a perfect team all of the time. But that's really not the reality that we live. So we need to have tools that help us navigate through these challenges. So resilience is really about having the capacity to experience and deal with those difficult, distressing, and negative events that happen and still be able to focus on the task at hand with an optimistic outlook that enables you to function at a high level. So when I say this is a practice and it's a learned skill, it really is, because our tendencies oftentimes fall back into a reactive state. And if we don't continue to work through habits of change, of addressing challenges in an optimistic way, even though that may be hard, we're typically going to fall back into those reactive behaviors. So taking time to really recognize how the emotional intelligence and the environment of psychological safety play together and how you interact with that at your own personal level is a really critical component to this. And these are concepts, next slide, and these are concepts that are not happen overnight, and they don't happen accidentally. So we are talking at a high level today to give you kind of an idea and an oversight of what these concepts look like. So you can then, take it back to your team or yourself and start to explore where this makes sense with where you're at in your own journey and your own resilience and your own emotionally intelligent space. So several studies show that employees in psychologically safe teams have an increased capacity for problem solving, innovation, creativity, and diversity. I don't think that comes to a surprise. If you feel safe, you're more keen to speak up, to bring ideas to the table, even if maybe, you're not completely sold on it. but you're not going to get shot down. You're not going to get belittled. You're not going to be, you know, reprimanded for trying to question the status quo. But through that, great innovation can actually happen. So one thing that, or a couple of organizations have done is really recognize the importance of hitting the pause button, allowing their team members capacity throughout the day to heal and be able to recognize where they're at in their own emotional journey. Obviously, you know, during the time of COVID-19 and direct patient care, there's a lot of internal and external and emotional stressors that are going on. And so a clinic actually decided to do or a hospital, excuse me, a 24/7, they called it a resiliency room. So it's a room where they set time aside with nice like massage chairs, comfortable like soft flooring, low light lamps, to allow people time to go in and pause and check in with themselves. Because if we can't take care of ourselves, how are we going to take care of somebody else? Another clinic in North Dakota actually created a clinician wellness program that was aimed to really help and address the frontline workers of COVID-19. We're going to hear from St. Peter's Health later on in the session, and they're going to talk about what they've been doing to support their employees as well. So those are just a couple of examples of how larger organizations, not even large, just organizations, decided to develop something to allow their teams to take time to check in with themselves. Next slide. Okay, so as we can see, emotional intelligence, resilience, psychological safety, they're all parts of the same chain. They all work together. Psychological safety can't be developed without team members who have resilient characteristics of confidence, optimism, self-assurance, and fearlessness. And you can't have those components if you don't feel safe in your environment. So that's kind of what we're tasked with as team members as we build high-functioning teams and really, you know, seek to improve the overall wellness and foster the well-being of our teams. All right, next slide. Okay, so with that, I am going to turn it over to, I believe, Betty from the, our slides may be a little out of whack here, so let me pivot a minute. All right, from Southwest Montana Community Health Center, we have Amy Gazy, who is a Master of Social Work student. She's a care manager. Then we also have Betty Warren, who is an RN, and she is their lead care nurse. They both have teams within the same organization that work tandemly with one another, but they both kind of have different, they've got some structures that we're gonna look at. So with that, I will turn it over to Amy, I believe.
I think you have to turn on our video. It won't let me. Go. Okay.
We see you. Yay.
Okay.
Welcome.
So I'm Amy and Betty's right here next to me. So I'll just go first. First, I'm going to give a little introduction to sort of how our organization is set up. And like Kristen mentioned, it's a community health center here in Butte, Montana. And Betty, as you were talking, Betty and I were talking about how we feel really spoiled with our administration. They set a really good example on integrated care and really taking care of staff and caring about our mental health as well as our patients' mental health and physical health. I mean, Shauna Yates is amazing. She really sets the tone for just when you were talking about the psychological health and safety. We really felt that. So that is very important for anyone who was questioning that. And so I'll just go right into my team. I'm the first lead care manager the clinic has had. And I work under Jamie Vanderlinden, who is the director of behavioral health in the Child Evaluation Center here at the clinic. I also work kind of as support in the Child Evaluation Center and as a forensic interviewer. And as was mentioned before, I'm also an MSW student, so I am also starting to practice in behavioral health, which I think helps with me showing my team how to integrate behavioral health in with the medical health. So then we have Tina Crummett. She's a care manager. She's kind of an expert in everything. But oh, rewind. I wanted to talk a little bit about how the clinic is set up, just so you guys can kind of understand how we all work together in like kind of a bubble. But we are all have very specific direction on what our bubble is. So every team, every doctor has a pod that they sit in, and there's 2 or 3 providers in each pod, and every pod has kind of we try to make every pod sort of have a specialty. So for instance, I sit in the blue pod, which is known as mostly like a pediatric pod. We do also have a family nurse practitioner in here, and we have a peds and adult behavioral health providers in here. So ideally, every pod would have that set up, have a care manager, have a therapist, and have your providers. So every day, all of us are communicating about the same patients that are, on our radar. So the same people are on the same people's radar. So like I said, I'm Amy. Tina sits in a green pod, which is our psychiatrist is in there, and our substance use providers, and family nurse practitioners. We have Victoria Templin. She works mostly with our homeless population. Haley we have a care manager that goes to the school. We have a school clinic here in town. So she works here and in the schools. Bonnie Joseph is our transitional care manager, and she works with our patients that have been hospitalized, to make sure they're getting their follow-ups done, make sure their social determinants of health have been evaluated and met by the time they meet with us, or set up an appointment to address those needs. And we also have Lana and Natasha, who are our RAP team, they are community health workers. So they actually go out into the community and meet with our most vulnerable patients. So they're generally are unhoused and using a lot of Medicaid money. So those kind of patients get sent right to these guys. And Victoria kind of oversees that team also. And you can go to the next slide. So like I said, I am the first lead care manager that the clinic has had. And I think that has actually been very helpful, because I can actually take a little time outside being just a care manager to make sure care gaps are being filled for our patients, whether it's they have a positive QH or
PHQ-9.
PHQ-9. Of course I stumble. If they have a positive one and they need to see a therapist, the provider will call one of us in to schedule that, or send in a referral to case management, so we can check in with the patient, see how they're doing, and get them scheduled with behavioral health or established with a medical provider. And I think it's important to note that we treat those both equally. So whether it's you have chronic depression or you have diabetes, why did it do that? I'm sorry, it was telling me I was going to raise my hand. Sorry. So we treat behavioral and medical health the same in this clinic. And it's, when we think about it, we were thinking about the fact that other clinics aren't necessarily set up like that yet. And I know that because I've been to them, and it just feels different once you've worked in this kind of environment. It really is a wraparound service, which is really nice.
Mm-hmm.
So for how I work specifically with my team to keep them very clear on what they're doing and who they're working with, I am very annoyingly consistent with communication. I joke about it. I email them and I'm like, am I annoying you yet? Because you're still not doing it, I mean, it's very, Betty and I are both very playful and fun people. And I think that that's also important. And I know, especially coming out of COVID and everyone's just, there's turnover and there's just all this, sometimes it just feels yucky, we got to be silly, and you can still get a job done and be professional and take some time to laugh. And I think that's pretty evident when you walk in our clinic and meet with any of us. Yeah, so emphasis on the word care. During my meetings with my care managers, I will if I do notice like around the building, if there's some negativity going around, because everyone knows if there's gossip, it gets everybody down, or if it's just you've had hard patients, I will take time during our meetings to teach them a coping skill or do a grounding skill with them in the meeting. And there are some people who've never tried these things, and do an actual check-in. I want to teach them so they can start to teach patients in meetings with them. Because, Jamie and I discuss how the word care manager is different than case management. And that's very purposeful because we are actually wanting to be a part and really emphasize the behavioral health so it gets the attention that it deserves. And if any care manager can go in and teach a simple breathing coping skill if they're meeting with a patient that's anxious about getting insurance, that really is effective. Delegating and assigning. Delegating is huge. If you are a leader, you need to delegate. Mm-hmm. And Betty knows even better than me. She has a much bigger team than I do. But if I'm delegating, I'm always very clear. I'm always checking in with my team. I try to do face-to-face time with them every single day and check in about their workload. Do you understand why I'm asking you this? Again, with the annoyingly consistent communication, like I want them to be satisfied. I also get to do, when we hire somebody, first of all, we're very picky about who we hire on our care management team. We want people who actually want to be a part of the mission of the clinic, which is really provide consistent care to anyone who walks in that door, and they do not get fired in this clinic. Unless it's extenuating circumstances. So we're very particular about who we hire. Either they need to be teachable or already trained in this setting. We have there's like 3 out of 5 of us that are getting our MSW right now. And it's really worth investing in those good staff. We use a work queue in OCHIN in order to assign people to the specific patients with referrals. I am in charge of behavioral health and care management referrals for the whole clinic. So I get an eye on those people that have been noticed by the medical providers for needing either, community resources or behavioral health. I have a very specific way of tracking that work queue to make sure that my team reaches out to them within 3 days and attempts at least 3 times and sends a letter to them to make sure there are no chances missed that these people have been reached out to if they've had a referral. And I kind of already talked about my goals of just wanting to really make sure that my team integrates behavioral health into their general everyday and really make them feel valued. And we are doing things differently. There's a lot of people here. I feel like Southwest, we catch a lot of people that are coming from places that have treated them very poorly. And they come here and it's like a breath of fresh air because there's such a caring community here. And I honestly think that's why, as a whole, we are a high functioning team. But Betty's gonna chat to you now.
That was such a nice little wrap up you did there. I don't know if I want to follow it. So go ahead and next slide, please. So my team is quite a bit larger than Amy, so I'm not going to go into the individuals in the role. First of all, I'm an RN who's been practicing here for about 7 years as a pediatrics nurse and then 1 year as the lead nurse. So I've really had a lot of time on the ground with working directly with the teams, and I feel like I've got a good idea of how our system works. So this slide kind of shows each individual pod, and with the RN being on the top, as they're kind of our team, they're the glue that holds the team together, really. They're the person who is doing a lot of the care coordination along with the care managers, and then following up with, labs and doing triage and just anything that you could think of. Underneath there are the providers that sit within our pods, and then underneath them are the MAs that work directly with those providers. We really tried to build these as a multidisciplinary team function. So we've got, like Amy was saying, we've got those care managers, we've got the behavioral health. In some cases, we've got the community health workers that sit in there on occasion, or the parent partners for the pediatrics group. And it's amazing because it's so well integrated that we can do what we call warm handoffs for just about anything. If we have a patient that says that they can't afford a medication, we can get care managers to come in, help them get their medications paid for, and then also get them over to our ACA folks who can get them set up with their insurances. So really, I feel like our group is like a family more than anything else. But in the interest of time, I'll have you go ahead and switch slides for me, please. Yes.
We have a question about
Sure.
some, I guess, logistics. So a question of, do your schedulers schedule for all, or are they also are they also assigned to a team for specific scheduling?
So that's a good question. It changed a little bit with COVID. We used to have schedulers specific for pediatrics, and then the rest of the schedulers for the rest of the teams. But now that we've had to move things around with COVID happening, we're trying to get all of the scheduler teams to be able to schedule for everybody. So it's kind of a work in process. There's a lot of communication and a lot of troubleshooting that we're doing. Lots of the trial, study, do, act, or however that model goes. So it's a work in progress, but at the moment, I think that we are doing pretty well. We're using templating setups. So each provider has a certain amount of slots per day for new patients versus follow-ups versus same day appointments, things like that. So do you have any comments on that?
I was just gonna say, everyone who walks in the door pretty much gets trained on how to schedule.
Yep, that's true. Yep, and we do have nursing
Oh,
teams that schedule as well.
Yep.
That's genius. Well, I really hate to cut you off on this portion of the high functioning teams. We're running out of time. There's fantastic though information on this slide. So maybe you could just pull out the high points and we can wrap up and get to our next practice presenter. Sorry about that.
No problem. So Amy kind of covered most of it for me. Really, she hit the high notes of cultivating that culture of robust new employee training. So we've got a very specific setup of people that we want them to meet and to really try to figure out their role in the clinic. Communication, and then also just utilizing that multidisciplinary team function to really just get all of those skills that they can bring to the table and help our patients the best we can. So,
well, thank you both so much. And if anybody has questions, especially like on the behavioral health and the treating behavioral health, like, any other like chronic disease, I think that's something that's really special and unique about something that they've highlighted. Feel free to reach out or put some questions in the chat. But I thank you both so much time for your expertise and your sharing. It was just so incredible to hear what your team looks like. So keep up that high functioning spirit. So thank you so much.
Thank you so much for having us.
Of course. Okay. So with that, we are going to invite Sheridan on our next set of slides. I may need to share my screen real quickly, Patty. So I have Sheridan Rolling. She's a PCSW and a care coordinator for Ivinson Medical Group. And here. Sorry about this. Hey, Sheridan, are you there?
Hi, yes, I am.
Hi, welcome.
Thank you. So as Kristen said, my name is Sheridan Rolling. I live in Laramie, Wyoming. I have my provisional clinical social work license and will hopefully be completing that by the end of this year. For any other social worker on the call, you may know the challenges of getting licensed, which Kristen got to learn so much about yesterday. So Ivanson Medical Group is a clinic attached to our very small hospital in Laramie, Wyoming. We have many different providers within the clinic. However, I work specifically with our gerontologist, Dr. Emma Biori. Additionally, I work with a clinical pharmacist, Dr. Tanya Woods, who's also a professor at the University of Wyoming. Our team also includes our RN, Peter, our patient care technician, Mackenzie, and then through the graciousness of our GWEP, Geriatric Workforce Enhancement Program, I get the ability to have a rotating pharmacy intern to support care coordination. Additionally, our team's been working really hard on now becoming Wyoming's first age-friendly recognized hospital. Through this, we focus on some evidence-based care called the 4 M's. And for those of you who might not be aware, the 4 M's are what matters: medication, mentation, and mobility. So touching base with our patients on what that looks like and how we can meet their needs, especially in rural communities. Programs that I help manage within our small portion of the clinic is chronic care management and transitional care management. Next slide. So ways our team-based care has changed because of COVID, like many clinics across the country, we implemented telehealth services, which has been a blessing and a curse, especially with our geriatric patients who have been resistant to learning or just unsure about what that process looks like. And like many, they love to see Dr. Biori in person and just get to chat and hang out. Additionally, we've been integrating more home visits for all team members. Dr. Biori has always made a priority to go to our assisted living and care center to do home visits to help decrease the burden on the teams there with transportation to our clinic. Even though it may be a couple of blocks, it can take a lot to have those patients come in. So in addition to her home visits, myself and our nurse, as well as the pharmacist, Dr. Woods, we will do home visits as needed for, like Peter, our nurse, will do lab draws, blood pressure checks. Dr. Woods goes and does a med reconciliation and helps fill pill boxes and ensures that these high-risk medications that some of our patients are on are understanding and educating appropriately what they need to be doing to meet those 4 M's. Additionally, it gave us a good time to look at those 4 M's. So coping mechanisms for our team. We've had consistent team meetings to review our goals, needs for the team, and education pieces through continuing ed or just updating each other on what's going on. So we've tried to have good communication. Dr. Woods and Dr. Biori have been great at bringing us in like appreciation gifts and little fun, snarky notes that I appreciate in times of just kind of stress. And then we've been encouraged to take time away from work. It is hard with technology expanding so much that we have access to our patients' charts at home if we need to. And my providers have it on an app on their phone. That reason I don't know. But it's really hard because then we get those notifications when we're at home, and encouraging each other to be present and saying we are leaving at 6 at the latest, and standing at my provider's door to walk out of the clinic with them to ensure that she shut off the lights and leaves for a long weekend. I'm convinced sometimes she sneaks back in, but I try to really encourage that we are away from work. And if one of us takes off time, having at least one other person on our team take off that similar time. So have that sense of camaraderie with taking off and not feeling guilty for leaving our team. So that is Ivinson Medical Group in Laramie, Wyoming.
Thank you so much. That final bullet point just really resonates with me, because I was thinking about that earlier, how technology is most definitely a gift, and sometimes it's a little bit of a curse when we are plugged in all of the time, and not being able to take that time to heal your own and recognize your own emotional intelligence is really taxing and not sustainable. So I love something as we say as simple, right? As encouraging people to take time away from work and having that time. So I really appreciate that. Jeff, are there any questions in the chat?
I'm not seeing any at this point for Sheridan. I'll keep my eyes open to see if anything else comes up in the next couple minutes.
Great. Well, thank you so much for sharing your experience and all of the great work that you're doing. Much appreciated. If anybody thinks of any questions as we kind of move towards the end of the session, please feel free to throw those into chat. But thank you again.
Thank you for having me.
Great. Okay. So with that, I've got a true subject matter expert on the line. So I'm not going to take too much time here for these strategies. But here are some, kind of tips and tricks that you can look to incorporate into your team as you look at creating and building psychological safety and emotional intelligence. So one thing that I will say again, this is not something that happens by accident. It's something that happens through taking time and dedicating that time, to better yourself and better your team, and then ultimately, bettering the care for our patients. So on this slide, we've just got a couple of activities, but I think I would prefer introducing Tina, who is with St. Peter's Health, and I'll let her talk through her role, but I think she has some good ideas and good tools that maybe you could take to either your care team or yourself to help you heal and take that time to pause. So with that, Tina, are you on the line?
Yes, I am, Kristen. Okay, so I'll go ahead and thank you. And again, it's an honor to have been asked to come and speak today. So my name is Tina Stern. I'm a licensed clinical social worker. I've been a therapist for, it'll be 12 years. I've been in this line of business, or passion, shall I say, rather than business. So I want to start off by, first and foremost, I'm just going to read something. And this says, a psychologist walked around a room while teaching stress management to an audience. As she raised a glass of water, everyone expected they'd be asked the half-empty, half-full question. Instead, with a smile on her face, she inquired, how heavy is this glass of water? Answers called out ranged from 8 ounces to 20 ounces. She replied, the absolute weight doesn't matter. It depends on how long I hold it. If I hold it for a minute, it's not a problem. If I hold it for an hour, I'll have an ache in my arm. If I hold it for a day, my arm will feel numb and paralyzed. In each case, the weight of the glass doesn't change, but the longer I hold it, the heavier it becomes. She continued, the stresses and worries in life are like the glass of water. Think about them for a while and nothing happens. Think about them a bit longer and they begin to hurt. And if you think about them all day long, you will feel paralyzed, incapable of doing anything. It's important to remember to let go of your stresses as early in the evening as you can. Put all your burdens down. Don't carry them through the evening and into the night. Remember to put the glass down. And I love that because I think it speaks so true to what we've been through for the last 2 years. And it's easier said than done to put the glass down. In my current employer, I work for St. Peter's as the employee behavioral health professional. So I'm available as a licensed clinical social worker to all employees within the organization. So not only am I available for one-on-one brief psychotherapy, I'm available to do topic discussions such as this. And I'm also available for other means, connecting employees with resources, connecting them with EAP. But one thing that I'm going to ask, if it's possible, is if everybody can turn on your cameras, because this helps me get a better sense in the virtual world of who is in front of the monitor. And then I'm going to share a very brief story, because I know it's getting pretty late and people are probably ready to go. I love how people pointed out the silver lining of the pandemic has opened us up to so many virtual resources. Yet at the same point in time, it has added a whole other layer of complexities, which includes being on Teams meetings or Zoom meetings. And I was on a Zoom meeting probably about 6 months ago, and my camera was off, but I didn't realize my microphone was on. And the senior director starts leading the meeting, and she asks a pointed question. She says hello and then says, "How is everyone doing?" And I'll keep my response, for the purpose of this professional discussion, PG. But what I said starts with SH and ends in a Y. And I'll just say, let's say I said crap, crappy. But I'll let you use deductive reasoning to fill in the gap. And all of a sudden, I saw that green little microphone on my monitor light up. And as that lit up, I was mortified. How could I ever, on a public forum with a senior director, say how I was truly feeling, or say how I felt the organization was feeling? And all of a sudden, my Teams message, private inbox, whatever we call it, lit up, blew up. And people were like, "Thank you so much. Thank you for sharing. I feel the same way. Thank you for being vulnerable." And I said, I'm not being, I didn't mean to be vulnerable with y'all. It just flew out of my mouth in what I thought was the privacy of my own office. So anyway, the reason why I share this is because by me accidentally sharing that, it opened up a safe space for others to share exactly where they were at. It gave people the opportunity to have a moment to truly sit in the middle of the uncomfortability and to recognize this sucks. I'm not okay. And where I've gone from that after that meeting, my phone rang right away, and it was that director. And she called and she said, "Are you okay?" And I said, "Yes, I'm okay." And I felt way better after airing what I aired than before. And we know this to be true. So the research can back it up, but what's more important than research, I don't want to dismiss research, but what's so important is having that human connection, which was already spoken to earlier. So how do we do that? We do that by doing what we're doing today. And what I boil it down to for our leaders and for our staff here is that, so now what? Now we've been through this pandemic, but there's uncertainty and still this anticipatory anxiety of the future. So now what? And this is where I say we have to get back to the basics. We have to keep it simple. And what that means is back to the basics. What do we learn when we're in preschool, kindergarten? We learn our ABCs. So back to the basics is ABC: awareness, balance, connection. And you can bring that to your teams. So with awareness, we increase awareness. What contributes to my stress? What fills my tank? And what's my vulnerability to compassion fatigue? And with compassion fatigue, if people are experiencing compassion fatigue, it doesn't mean that we haven't been doing a good job. It actually means that we are good at what we do. So now we have to figure out, what do we do with that? The B is balance, setting boundaries. And this is where I laugh at myself, where I'm like, work-life balance, okay. through, which is virtually impossible. And virtually also like this virtual world. How many of us can really set our computers aside? How many of us can mute our cell phones so that we're not hearing that ding or that Teams message ding when it's 6 o'clock at night? Balance also includes, which can be really hard, the gratitude. You know, if I have negativity, do I also have positivity with gratitude? Doesn't mean I have to like what I'm experiencing, but just being grateful for what I may have. And connection. We've talked a lot about connection. So here's some simple acronyms too. I know we're like so close to 5 o'clock and I promise I will not keep you over. So some helpful acronyms that can be taken to our teams are like HALT, right? Hungry, angry, lonely, tired. NEST, nutrition, exercise, sleep, time for self. STOP, which the S literally stands for stop. Take a breath, observe, and then proceed. And on a almost final note, my direct supervisor continued to ask me over the last, I don't know, year, how are you? How are you doing? And finally I said, can we stop asking how we're doing and can we just do a scale? On a scale of 1 to 10, where am I? Because sometimes a scale is easier to speak to, 1 being, you know, really not well, 10 being feeling extremely good. Sometimes just a number, people are able to embrace and engage more with that than speaking to a feeling initially. And on a final note, I'm going to read this. And this is so important for leaders. The bottom line, authentic appreciation brings positive results to your organization and mitigates the negative consequences that result when employees don't feel valued. So our job as leaders is to ensure that the employees within the organization feel valued. So that's my 2 cents.
I think that's more than 2 cents. I think that's like, I don't know, Buffalo nickel, something, some big currency. That's more than 2 cents. Fabulous. Thank you so much for those like words of wisdom and those fantastic examples of innocent ways to approach this type of work. I used the scale today, night and day. So much easier to start a conversation when you start that way. So that's something I've taken from this and am already implementing into my own world. So as we get into this, here's our kind of calls of action for some things to kind of think about. And so, you know, with this, we recognize that there was a lot of information that we threw out there, and that was intentional. We wanted to, you know, offer high-level points of view for these very complex topics with the kind of whet your palate, I guess, and get you interested. So with that, we're going to kick off a poll about our next opportunity when it comes to education. So what type of education would you like to see? So with that, I'll let Maynette kick off that poll.
Is it the topic one?
How to continue this topic, poll question
Okay.
number 1, yeah. Perfect, thank you. So this is how we gather information on what is important to you. What would you like to see from our next affinity group? And for those of you that don't know, affinity groups are a deeper dive into a topic like we talked about today. So let's get into the action steps of these different areas. So we usually do these in a series. So we'll just kind of wait for you all to respond on that. All right, looks like that slowed a little bit. Okay, so we'll go ahead and end that poll. And then, So this is our large group education event. We do these on a quarterly basis. So we want to also kind of pick your brains of, outside of the deep dive, what are some other areas that are important for education? So our next large group education. So this includes QI for diabetes and pre-diabetes, behavioral health. Maynette, if you could kick off poll number 2. There we go. Okay, and if there's any problems with challenges on voting, I see some Jessica in the chat. You can go ahead and either chat it in, or I think, or you can email me, or whatever is more convenient. Okay. All right. All right. And I recognize like the topic of what's important education wise is always a little bit loaded, and it changes kind of from day to day and almost sometimes feels like hour to hour. So if you have any suggestions, please feel free to reach out to us. We have a wealth of resources here that we're able to share with you. So all of the slides will be made available to you after the presentation, as well as a recording. So you can feel free to shoot this off to your care team members if they weren't able to make it. So to all of our presenters and all of our attendees, thank you so much for joining us today. We understand you all are very busy, so it's really our honor that you're able to join us and take this time. So in the spirit of emotional intelligence, go pet your dog, pet your cat, or take some time for yourself and get out there and maybe enjoy the outdoors. So thank you all so much, and stay healthy and take care out there.